Hi everyone who's joined so far. We're just going to wait a couple more minutes to see if anybody else joins. And also the meeting is being recorded, so if you don't want your cameras on or anything, just know that.
Okay, all set here. Over to you now.
Okay, thanks, Parveen. Okay, so I think we'll make a start. So, hi everyone, and welcome to this Shivar webinar, which is part of a wider series of webinars that we've been doing as part of a book launch for gender-based violence, a comprehensive guide that was edited by our co-leads, Dr. Michaela Rogers and Professor Parveen Ali, who you'll have just heard. So, if you don't know already, a bit of background about the network. We're Sheffield Interpersonal Violence and Abuse Network, and we're an interdisciplinary group which aims to develop knowledge about interpersonal abuse and how it should be managed. The members of our group come from the fields of health, social sciences, arts and humanities, and the network is also made up of a range of people from academics to professionals and practitioners. I'll share a link to the website at the end of the webinar in case you haven't got access to it, where we just update with all the different events that we're doing. So today we're joined by Dr. Silvia Fraga Dominguez, who is a lecturer in forensic psychology at Birmingham City University. So her research examines different types of interpersonal violence with a primary focus on older victims and survivors of abuse by trusted others like family members. She's primarily researched help-seeking behaviours and access to the criminal justice system, and has completed a PhD in 2021 that examined the help-seeking behaviours of older victims and informal supporters, such as family and friends. Her research is also focused on financial abuse of older people and public perceptions of abuse. So, yeah, without further ado, I'll hand over to Silvia, who's going to be presenting for us today.
Thank you, Holly. I'm just going to, share my screen again. Okay, just let me know if everything's working okay.
Yep, we can see that.
Okay, great. So hi everyone, and thank you for inviting me to give this webinar. My name is Silvia and I am a lecturer at Birmingham City University, like Holly said. So thank you very much for attending as well and for joining in. I will be talking today about older adult mistreatment, and I will be focusing primarily on help-seeking behaviors and access to support, but I'll also give you a bit of an overview at the beginning. So this is just a slide to kind of introduce a couple of initial thoughts or caveats in terms of how I am approaching this presentation or how I have approached my research. So the first is that there are some challenges when it comes to addressing older adult mistreatment, and many of these are in terms of the definitions, the names, the concepts. So I just want to be very clear that I am approaching these from a specific perspective, but I'm aware of the different definitions, debates, and issues around this. And the other is to say that as well, I am approaching this in a way that is very much influenced by my educational background. So like Holly said, my background is in psychology and more specifically forensic psychology. So this will influence how I approach the webinar and has influenced my research in this area so far. So what will the talk look like? What will I be talking about? I will start with a brief overview in terms of the definitions and characteristics of older adult mistreatment, its prevalence and impact. It'll be quite a brief overview, but there is a longer overview in the chapter as part of the book that Holly mentioned. And then most of my talk will focus on help-seeking behaviors. which has been my main area of focus. I'll talk about interaction with formal services as well in cases of older adult mistreatment. And this is based mostly on my research findings, mostly from my PhD, but also wider research in this area. And I will discuss and explore. Sorry, I can see. I'm getting the notifications about people in the waiting room. I don't know if that's displaying for you, Holly.
Yeah, don't worry, I'll add them in. So
Okay.
yeah, that's all right.
What I was saying, sorry. I will discuss and explore access to support from the perspective of victims and also those who support them informally, such as family members or friends. I will then briefly discuss a fictitious case study which we published a few years ago and which exemplifies some of the challenges from the perspectives of victims, but then also how this can be addressed from the perspective of professionals. And I will then end with some key messages and future directions. Now, if I've timed this well, which I think I have, this should take around 30 minutes, maybe a little less, and then there'll be plenty of time for questions. But of course, I'm more than happy to be contacted afterwards as well if you need to leave or if there's not enough time for your question. So starting with that overview, what am I talking about today? Older adult mistreatment is also sometimes known as elder abuse or the abuse of older people. And the abuse of older people is the term that the World Health Organization uses currently, and I have used their definition to inform my research. So within the WHO definition, we are talking about a single or repeated act or lack of appropriate action occurring within any relationship where there's an expectation of trust and which causes harm or distress to an older person. And by older person within this definition, we're talking about somebody who is 60 and older, even though, of course, to some degree, this may not match local definitions or every country. In terms of types of abuse, we're talking about physical abuse, psychological or emotional abuse, financial abuse or exploitation, sexual abuse or neglect. And in terms of who perpetrates this, so who are these trusted others, this is often family members such as adult children or partners, but can also be carers or friends, for example. And in terms of how many people are affected, if we are looking at estimates across the world, it is estimated to affect 1 in 6 older adults every year. These are community dwelling older adults, so older adults living in the community. There are more limited data for older people living in institutions such as care homes or nursing homes. But the estimates that we have, even though they may not be as reliable, do suggest that there may be higher rates in those institutions potentially. And there's an expectation that the numbers of people affected will increase due to trends in terms of aging across the world, although particularly in Western countries. Just to state that usually we do see a lot of disparity across studies in terms of numbers, and there are issues with measurement, and a lot of the data does come from the same countries. So in terms of impact, compared to other groups, we know that older people who have experienced abuse have been found to experience significant physical, psychological, and economic or financial consequences. So things like increased rates of healthcare use, long-term care placement, hospitalization, and depression. And it also has been linked to a major financial impact, mostly for victims of financial abuse, but also in other cases. And overall, just as a general point, we do see that compared to other groups, older victims and older people in this context have received little attention in research and sometimes in practice compared to other groups. And particularly coming from my discipline of forensic and legal psychology, there seems to be a clear omission there. So like I said, this is a very, very brief overview, but there is a lot more detail in the chapter, so I very much recommend reading that if you haven't, and it'll expand a bit on all of these points and a bit more in terms of others. But for today, I'm focusing primarily on help seeking, which is also what I focused on for my PhD. So why did I decide to focus on help seeking for my PhD and today as well? Well, the main reason is underreporting. So we have that tip of the iceberg image there, which a lot of people use for many different areas, but essentially the fact is that we are only seeing a few cases that reach formal services. The estimates in the US are between 4 and 14% of cases, and we've got similar estimates in the UK. And increasing help seeking is very important for intervention in general, and particularly early intervention, so that we can prevent as much harm as possible from occurring. And just to say that in my research and throughout the presentation, I've approached help seeking in quite a broad sense. So from disclosing or talking to an informal source of support, such as a family member, a friend, to disclosing to a formal source or formal reporting, to actually asking for help and sometimes engaging with services. And in terms of what exactly I focused on within help seeking, because it could be many things, what I did is look at what previous research at the time had primarily focused on, to try to focus on things that hadn't been explored as much. So I focused on kind of what was the who, the what, and which cases researchers had looked at primarily. So previous research focus had been primarily on professionals, things like how to increase screening, detection, and reporting, which was obviously very important and still really important. But because of that, I decided to focus on older victims and survivors and try to understand their experiences and perspectives, and also look at the role of informal supporters, which at the time hadn't been explored all that much. In terms of the what, so what aspects of help seeking had been looked at primarily, a lot of the focus had been on formal reporting, so to police or to other formal sources of help. And there had been a lot of focus on the barriers, so what makes it harder to seek help, but not so much focus on other aspects of help seeking. So with that in mind, I decided to, as much as possible, focus on both formal and informal disclosure. And again, as much as possible, look at barriers, but also facilitators. And by that, I mean things that make it easier to seek help or enablers of help seeking. And in terms of, I wasn't meaning to show that yet. In terms of which cases they had looked at, it was primarily community dwelling. So older people living in the community and victims without dementia, mostly due to ethical considerations. So I try to look as much as possible at both those living in the community and the experiences of those who may experience abuse in institutions, such as institutional abuse or mistreatment, neglect, and then also look at victims with dementia, even if it wasn't by directly asking victims with dementia, trying to get their experiences reflected somehow. So that was a general focus of my research. And in terms of how I conducted my PhD research, I will give you a bit of context in this slide. It's not a lot of details, but if you want any more information, I'm happy to provide that. But the first thing I did was a systematic review, and this was to understand what the existing literature looked like. So looking at barriers, facilitators, which I already mentioned, but also who they sought help from. So what kind of sources, informal, formal, and specifically which services they contacted, and also the responses that they obtained from these. And 19 studies were included and synthesized from this. Then the second study was the largest, and it was a secondary data analysis of over 1,600 cases that were reported to a UK helpline. And I was able to examine help seeking by older victims and informal supporters in that sample. And finally, I had a smaller study, which was qualitative. And this was a study with 19 informal supporters of older victims of abuse who shared their experience via a survey and or interview. And in the next few slides, I'm going to talk about findings across studies. So some key findings across studies rather than talking about each study in turn. So starting with some general findings about help seeking and the trends that we know exist in older people with regards to help seeking. So what I found, for example, in the systematic review and in the broader literature is that help seeking has been conceptualized in various ways. So some studies may be looking just at formal reporting to police or other authorities. They may be looking at informal disclosure, so it varies across studies, which also means that how many people seek help also varies across studies quite a bit. So in my systematic review, it ranged from 11% to 70%. As you may imagine, 11% is when we were looking at, when the researchers were looking at a very narrow definition of reporting to formal authorities or the police. And on the other hand, 70% was when it was about disclosing abuse to anybody or talking about abuse with anyone. Across studies, we do see a slight preference for informal sources of help, like family members or friends, even though the preference does seem to depend on the type of abuse and also how severe it is. And like I mentioned earlier, across studies, the focus has been more on barriers, so what makes it harder to seek help rather than what may facilitate help seeking. What there seems to be agreement on across studies and wider literature is that help seeking is a process, so it's not a single conversation or disclosure. Disclosure may take place over a number of conversations, but also even once someone discloses, it doesn't mean that they will engage with help that is offered. So victims may not accept that help or may withdraw from services. So it's very much a continuing process. So what makes it harder to seek help from the research that we have? Like I said, there's been a lot more focus on barriers. So in that systematic review, I identified several themes. And then I look at these themes of barriers in the secondary data analysis to see which ones were most common. So they are ordered in this slide from most common to least common. So the characteristics of social networks were most commonly present, and these were things such as being isolated or lacking effective social support, or having a support network that doesn't want to get involved. Some victims also were not able to communicate with others, and this was sometimes due to the perpetrator's influence or control. The second most common group of barriers were feelings or perceptions of personal circumstances. So for example, shame or embarrassment, but also feeling too physically frail to seek help or go through the process of seeking help, particularly when they thought of accessing the criminal justice system and thinking about all the delays and steps. But there were also sometimes ambivalence regarding seeking help, which makes sense in the context of the sample, which was primarily abuse and mistreatment perpetrated by adult children. And then third, there were barriers related to formal services. So this was sometimes issues with the services response and involvement if they had already been in touch with some services, but also sometimes not wanting to involve specific services due to attitudes that they had towards those. And this was sometimes social services or the police. And again, in these cases as well, the perpetrator was sometimes challenging access to services or preventing them from getting in touch with the victim. And sometimes there was also lack of accessibility in services. And the fourth most common were fear of consequences for themselves or the perpetrator. So sometimes they were afraid of the perpetrator or what they could do, but also sometimes they wanted to protect the perpetrator from harm. And fears for themselves, other things that they may have been fearful of were going to a care home or nursing home if they reported. And other barriers from the systematic review, which were also present in the sample related to the perception of abuse, family barriers, and also cultural, generational, and religious barriers. So this was what made it harder. What makes it easier to seek help? Like I mentioned earlier, this has received less attention across studies, and I've also I've tried to explore this as much as possible in my research, but usually it is harder to identify facilitators. So exactly what makes it easier to seek help are enablers, but we do know that a good network, both informally and formally, helps. And in the next few slides, I'll talk a bit about informal supporters and also about formal support. But most commonly, what I've identified are circumstances leading to help seeking. So what we see is that sometimes victims seek help for an ongoing situation of abuse once once they perceive it as critical or something changes that makes them that prompts them to seek help. There could be an escalation, so different types of abuse may be perpetrated or may become more intense. And sometimes they seek help when they fear for their safety or the perpetrators. So in terms of those informal supporters, which I said are quite important and were a focus of my research, we know both from my research and other research that they play a very important role in supporting older victims, but also in connecting them with services. So a study found that if there was an informal supporter in the life of the older victim or survivor, they were more likely to engage with formal services. So it's not just only that direct support, but also connecting with formal services and ensuring engagement. But what I found and other research has found is that they face many barriers themselves, similar to victims sometimes, but some unique barriers, particularly in relation to contact with services. So they sometimes struggle to find the help that they need for the person that they are supporting. And also what we've seen is that they experience significant impact as well as a result of their involvement. And this can be psychological, physical, and financial. And in terms of the barriers that they experience with relation to services, sometimes they may face things like ageism or age discrimination, such as the disclosures of family members not being believed. But also sometimes there's a lot of issues as well with the perpetrators' involvement and the interference that they play in that contact with services. So I'm going to move now over the focus slightly to professionals, even though this is still going to be a bit from the perspective of victims, but then seeing what professionals can do to address some of the barriers that victims experience. So I have a case study here that I'm going to talk to you about in a moment. And just for a bit of context, this is part of an article that we wrote a few years ago in collaboration with a forensic nurse. This forensic nurse was working at a Canadian specialist service. So she wrote 2 case studies, but to preserve anonymity, these are not actual cases. They are an amalgamation of different cases that represent typical presentations to the service. So I've chosen one of them, and you can read the whole article or the other. You can just contact me if you don't have access. But this is a case in which a victim does disclose abuse, but is deemed to have mental capacity and that she has no cognitive impairment or limitations of any kind. So this is a case of Mary, a 75-year-old woman who presents with her son John to the emergency department with a fractured hip, and she reports that this is the result of an accidental fall. So initial barriers that may have prevented her from disclosing the actual reason of the fall, which we will see later, could have been, in this case, pain, the lack of privacy, the presence of John during history taken. But she is admitted to rehabilitation, so she's got more time with these professionals, and she develops a trusting rapport with the social worker. This social worker witnesses an aggressive verbal interaction with John, and she expresses concerns, and as a result of this, Mary discloses a history of emotional abuse. And also John's diagnosis of schizophrenia, which in this case is playing a role in the abuse, but also in the responsibility that she feels towards John and his care. The social worker then vouches for the expertise of a forensic nurse, and Mary consents to a referral to the specialist service that I mentioned. And then the social worker facilitates the first meeting with the forensic nurse and leaves only when Mary is comfortable. So there's just a bit of background to the case, and then in the next slide, I'll talk about some of the barriers experienced and how these were addressed. But I just wanted to mention in this slide how this is a good example of how disclosure and reporting can take time. And obviously, if there had been no further contact after that initial visit to the emergency department, there may have been no disclosure, and even then this may take many conversations once there's an initial disclosure. Sorry, I forgot about this last point, but the forensic nurse meets several times with Mary, and she discloses the physical and emotional abuse in more detail. So throughout that time that the forensic nurse is working with Mary and previous services are trying to engage with Mary, there are several barriers to disclosure and engagement that were identified by services and addressed. So one of the barriers that she was experiencing, she was quite concerned about confidentiality, both with respect to John, but also because she had a relative working at the hospital. So she was really worried about the relative finding out, particularly because she was quite ashamed that her son was doing this. So they made sure to meet in places that John could not access, and they also spent a lot of time discussing privacy policies and processes that would ensure that this relative would not find out about her situation. She was also experiencing a lot of shame, which is common, is a common barrier about her situations. Some of the things that help were discussing how common these experiences are, particularly for older women, but also taking a non-judgmental approach. So they found that it wouldn't be helpful to label John as an abuser because he was her son, and she felt that attachment and that responsibility over him. So using different language and being non-judgmental was the most helpful in engaging Mary. She was also feeling quite hopeless about the situation, how it could be resolved, and also about her choices being respected. So they reassured her that her choices and her wishes would be respected. They facilitated access to services that could support her and provide support for the needs that she had and improve her situation, and also reconnected her with supportive family members that she had lost touch with. And finally, she was fearful of consequences for John, and she desired to maintain a relationship with John. This is obviously not always going to be the case, and it's not always going to be possible. But in this case, they managed to, she moved to a retirement home that she could afford while still affording to care for John. And they also trialed supervised visits with John, which in this case worked and meant she could continue having those supervised visits with no further incidents of psychological abuse or any other harm to Mary. So it's just a case study, a unique case study, and everyone will be different, but it is a helpful way of seeing some of the barriers, how they can present in a case, and how they can be addressed. And the main takeaway from this is the need for a person-centered approach and respecting victims' choices as much as possible in order to engage the person in the care and intervention. So I just want to finish now with some key messages and also some future directions. So in terms of key messages, we do know that there are many barriers to help seeking for older victims. And often that systematic review I publish is cited to provide that support, that there are many barriers. And I don't disagree with that, but victims and survivors can and do seek help. So it is important to not make assumptions that they won't seek help, and we only should focus on professionals detecting, but also understand how older victims can disclose abuse. So there should be more of a focus on facilitators understanding this better, and also on reducing the barriers that we know exist. We can see that that informal supporters play an essential role, but also they face their own barriers and impact. So they need adequate support so that they can support victims themselves and connect them to appropriate support. Services and professionals are likely to benefit from a person-centered and non-judgmental approach to engage victims. These are going to be tricky cases, so it's obviously not an easy solution, but this is the main takeaway from the research we have. And I haven't talked too much about access to justice. It hasn't come up in my research as much, but just from broader research, I think it is important that for older victims who want access to justice, this is available, and that there should be adequate support to facilitate this. We have structures in place to support older victims and witnesses to access the criminal justice system, but some research suggests that these aren't always utilized. And this means that a lot of older people lack access to justice. And in terms of some future directions or priorities, there are many, but I'll focus on three. I think collaborations between researchers and practitioners are important, as well as those affected directly by these issues, such as victims, survivors, and their family members. I'm currently involved in a similar partnership, but in a different area of research, and I have seen how beneficial it is to for moving the field forward and for having all the key people involved and collaborating. So I would like to see this happening in this area as well. So if you are a practitioner or work for an organization where you think there will be scope for this, then I'm happy to be contacted. I think, second, we need more perpetrator-focused research in this area to help advance prevention, intervention, and risk management. We do have some good advances in terms of risk assessment and risk management. So my former PhD supervisor, Dr. Jennifer Story, who was also a co-author for this chapter, has developed a risk assessment tool which covers all types of older adult mistreatment and follows that WHO definition. So it's looking at trusted perpetrators, people in a position of trust. And then finally, I think financial abuse is a major concern. I've done some related research in this area, and we know that it co-occurs with other types. It's not just financial abuse, and also that it has a major impact on victims that isn't just financial. And it looks like it's one of the most prevalent types in a lot of the studies that are coming up. So that was all that I wanted to talk to you about. I think I've kept to time. But yeah, happy to take any questions now, but also you have my contact information if you want to connect with me or follow me on Twitter. And yeah, thank you.
Thanks so much, Sylvia. Yeah, okay. Yeah, thank you so much. That was a really interesting presentation and also really important research. So yeah, thank you for sharing that with us. Like Sylvia said, we'll take questions now. So that can either be through the chat box, or even better if you want to put your mic on and ask a question. While we wait for those to come in, though, there was a couple of things that I thought of in terms of as well. My own research is quite similar in the sense of help seeking, and I just wondered if you'd found any like intersections, so individuals' intersectional identities and how they kind of further impacted people's help seeking, whether that's like with services and barriers.
Yeah, that's an area I don't. Is a great question. Is an area where I don't have a lot of research myself. Is something that I want to look into further, because like I am aware of some people, for example, in some researchers in Wales doing some very interesting research in older LGBTQ plus victims of abuse. I think there's also some other research coming up somewhere in England. I can't remember where, but I think that's an example of an intersection where there are going to be additional barriers. So just anecdotally, things like fear of being outed by the perpetrator or the perpetrator threatening to out a victim. So that's just one of the examples I can think of. But yeah, there are many intersections, and unfortunately in the secondary data analysis, for example, I wasn't able to look at things like ethnicity and how those may have an impact. I just didn't have the data, but that's going to be, there's been some related research that obviously finds additional barriers. And we know that from other fields. So yeah, the answer is yes, I think is really important. I just don't have a lot of data from my own research, but there's definitely research out there identifying those, the additional barriers that may be present depending on the different identities and circumstances of victim survivors.
Mm-hmm. Yeah, no, absolutely. Thank you.
Okay.
Has anybody else got a question they'd like to ask? Again, you can just put your mic on or pop it into the chat. I don't know if I can actually see the chat from here, but well, in terms of your future research, like you mentioned about perpetrator-focused research. I thought that was really interesting, especially in terms whether the relationship between the perpetrator and the victim can be quite complex. And like you said, with the example that Mary wanted to maintain that relationship with John, I just wondered if you found anything about how professionals can help to facilitate that relationship, or in a way can help perpetrators in that way as well.
I think it's really tricky because, and I'm obviously not a practitioner, and I can't speak for all the challenges that will be faced. I think in some cases it just won't be possible, and in the other case, for example, in that article we published, it was not possible to maintain that relationship because they found this was a husband perpetrating abuse. The victim had dementia, and they found that those visits were actually distressing the victim, so it was not possible to have even supervised visits. So I think it's going to be very much focused on the individual's needs and making sure that there is no further harm. And it may not be possible in all cases. And because of the diversity of potential perpetrators is really tricky, because in some cases it's not going to be something that the victim even wants. But I think with that adult-child dynamic, which we do see a lot, I think in some cases it looks like the only way of engaging the older person who is suffering abuse may be to provide some support, because they may not engage or accept the support unless they know that person is also not going to end homeless or lose their jobs. So I think even if somebody is thinking, oh, I don't want to support that person who's harmed the victim, actually in some cases it may be the only way of engaging and making sure that the victim doesn't suffer any further harm. So yeah, I'm not saying it's easy, and I'm not claiming that it is, but I think it is that double focus sometimes in order to be able to engage the victim with support.
Yeah, absolutely. And in terms of that, like future research then on the perpetrator focused, are you planning a study with perpetrators? Would you be?
I'm not at the moment. I know, so Jennifer, Dr. Jennifer Story, my PhD supervisor, does more research in this area. I can't speak for anything specific that she's working on, but it's definitely an area I want to move on to more. I don't have anything at the moment specifically planned. It is quite tricky because we don't have a lot of data. We're starting to have more data, but I think looking at those needs would be kind of one of my priorities, looking at their interaction with services. I've also come across a pattern in research that there may be two family members. One is trying to help, one is perpetrating abuse, and then there is allegations of abuse against each other. And then I want to really look at the perspective of professionals, how often they come across these, how do they deal with these, because they may have generally two relatives that are saying, no, it is the other person perpetrating abuse. And obviously I can imagine it would be really tricky it would take a lot of time and a lot of, examining collateral information to really understand what's happening. So I think understanding that perspective of professionals and what they come across would be really interesting.
Yeah, absolutely. And in terms of like the complexities of it, isn't it, in the relationships, how interconnected they can be. We've got a question from Annie. So Annie's asked, did you find that the pandemic impacted access to support or exacerbated abuse?
Not from my own research, because I finished my PhD research around when the pandemic started, but there was nothing mentioned in my research, nothing in my research that mentioned the pandemic specifically. What generally the literature would say is that, that access to support became harder. I think we've seen patterns across, across the board, that any kind of abuse or mistreatment that is going on behind closed doors, but also in institutions, will have exacerbated during the pandemic. And then I think that the problem is there are fewer people who may be keeping an eye on things or becoming aware. So without pandemic going on, there's already a lot of isolation and control. So you will see a pattern where somebody is isolating the victim, preventing contact from other family members or from services. And I think the pandemic will just have made that much easier.
Yeah.
So yeah, that would be not directly from my research, but I think that's generally what we've seen in different studies.
Mm-hmm. And Claire has said, I might have missed it, but is there data on when the abuse might have started? I was wondering if it generally seems to start when the victim is an older adult or before.
I'm trying to remember from my own research, and I know I have this somewhere, but I can't remember exactly the data. Most of my sample, it looked like it had started when they were older adults in that secondary data analysis. And in the third study, it also had primarily started after they were 60, which is the cutoff that I use. In a few cases, it had started before. Now, more broadly, there is a bit of, most people find that there is some long-standing situations of abuse, and a lot of these tend to be more intimate partners. So it's like a long-standing situation of domestic abuse that worsens or changes in older age. Because sometimes it just changes in the types of abuse perpetrated. But a lot of what I have studied tend to happen start from the data that I have after the person was older. Of course, yeah, it's difficult to know whether there was something else before with the data that I've had access to. But yeah, I think there are different patterns there. So that's a very, very important question and distinction.
Yeah, absolutely. Has anyone else got any other questions they'd like to ask? Got a few more minutes to add them in, but yeah, if not, I'd just like to say thanks again, Sylvia, because it was really, really interesting, and like I said, an important area of study. And I also think as well, like you'd said, that most of the research on it is focusing on barriers. And I thought that the approach to looking at more at, well, what can professionals actually do? I thought that was a really interesting approach to take.
Yeah, I think it almost seems like it's been quite a negative focus, and I think it makes sense, but we tend to focus on the negative, right? We tend to focus on the numbers and the impact because we're trying to raise awareness of these issues. But I think sometimes that prevents us from finding solutions. So I think it is important to look at both. And I think otherwise we're just assuming, there's all these barriers, they won't seek help. But actually they can, and we shouldn't just be saying somebody else needs to do it, like professionals. I think we need to look at what can be done. Sorry, I've just seen a question coming through the chat. What can services do to be more accessible? I think it's difficult to say because we also can't make generalizations that an older person is going to need specific support because they may not have any additional needs. But we do see with increasing age that people usually have more physical health problems or disability or cognitive impairment, for example. So some of the things that have come up are that in the research that I reviewed, so not just my own research, is that, for example, some refugees, older women and older people in general, they found that they didn't seem appropriate for their needs because they were really tailored towards younger women or women with children, with young children. So they felt that that wasn't as accessible to them, or maybe they didn't feel that that was appropriate for them. So it's going to depend a lot on the needs of the specific person, but I think, potentially any service just making things as inclusive to everyone as possible will just help as well with the needs that older people may experience. I know it's kind of a general answer, but that's what I can think of right now. There may be other suggestions in the literature, but nothing I can think of right now.
Yeah, I think these barriers, they're often like overlapping, aren't they? And I guess that's why I asked about the intersecting ones, and like you said about LGBT older adults as well, because my research is focused on sexual and gender minorities, and it does seem like a lot of the barriers overlap, maybe in terms of like who is perceived as like the typical victim of abuse, and who services are kind of more catered towards.
Yeah.
Yeah.
I think even just, I guess those awareness campaigns and just making, not targeting services at a specific population, like you say, because it's all of those intersections, and we do see with LGBTQ plus people that they sometimes don't think yet that those services are for them, and it may be that they are, and they are actually, they could support them, but it's about that message that is not reaching them, or it doesn't feel like it is the service for them. And I think it may be the same sometimes with older people. They sometimes may not know where to go, or people supporting them, and they end up calling this service and then calling this other service and being sent to another place. And I think there's just a lot of, obviously, that prevents further help seeking, because just any of us at any point we will have contacted a service. If you don't get the response you need, or if you feel discouraged, you're usually less likely to want to contact another service or pursue. Maybe not at first, but imagine that you are told no, or maybe this is not the service for you 4 or 5 times. I think that, with all the other barriers, just kind of is probably going to prevent you from to seek help. So
yeah, absolutely. And like you said, in terms of like representation, isn't it? It's, if you're not being represented, then it's so much harder to access those services. I don't think we've got any other questions, so I think we'll end it there. I've got a link to our website, and we'll be advertising our next webinar, which is it's not long now, I think it's a few weeks, and that's on harmful practices. We've got 2 speakers for that one, so yeah, do come along if you're interested in that. I'll send out the information to everyone who's come today as well. But yeah, just to say thanks again to Sylvia for the presentation, and thanks everyone for coming along.
Thank you for inviting me, and thank you to everyone for joining. And like I said, happy to be contacted or emailed if anybody wants further information later on.
Maybe there, but yeah, I just wanted to say again, thank you, Sylvia. That was really great. Really went well. Great presentation.
Thank you so much. Yeah, thanks for inviting me. And if you need anything, just let me know. I'll try to join some of the other webinars.